Welcome to Rajya Sabha Television. I'm Anshu Jaising and you're watching special report on demographic dividend available to India. In order to exploit the demographic dividend, we look at four areas: the health aspect, the education needs, the gender concerns and the skill needs. With half of its population under the age of 30, the nation is now known as Young India. With the most productive years ahead, the nation's growth lies in youth. However, the government has to ensure that this opportunity remains and doesn't become a burden.
Elementary education is one of the major priorities of the government. There would be a residual gap in providing minimal school infrastructure facilities. Government would strive to provide toilets and drinking waters in all the girls' schools in the first place. An amount of rupees 28,635 crore is being funded by the Sarva Shiksha Abhiyan and 4,966 crores by the Rashtriya Madhyamik Shiksha Abhiyan.
Big promises in the Finance Minister's budget speech last year. In pre-budget consultations ahead of Budget 2015-16, educationists want special attention to elementary schooling, with a focus on better schooling infrastructure rather than the sheer number of schools. Areas like poor teaching quality, access and innovation remain aspects that limit learning outcome.
Nothing good is going to be stopped for want of funds. The things that we are now talking about, the classroom management, the pedagogy, I don't think that requires a significant amount of fund. So whatever you have allocated, it can be done with that.
In 2014-15, the education sector received an allocation of 68,728 crore rupees, up from 61,857 crore rupees in 2013-14. The school sector got 51,828 crore rupees, out of which 16,900 crore was given for higher education. This time, educationists demand an allocation of 73,807 crore rupees and an increase of 1% from the total GDP to address the gaps. Educationists say the 2014 budget did bring relief to the sector, but failed to bring about any significant increases in outlays.
There's no sense of urgency. That is a big gap. We think, for example, everybody in the economists and so on will think about foreign investments coming in India and then India will grow. But that human capital, our own human capital, can be limiting in India's growth is not something that people are talking about. I think that will start mattering. Also, if children don't grow up to be educated, literate adults, then that can cause disruption.
It's clear the government realizes the need for massive reform. To address the problem of the lack of trained teachers and education outcomes, the government introduced initiatives like School Assessment Program and Pandit Madan Mohan Malviya New Teachers Training Program. Social development institutions, however, say measures fall short of what's required.
We could not implement the RT Act. 5 years has gone and only 10% schools are RT compliant. And we have 12% single teacher schools. We have lack of water, we have lack of toilet, we have lack of classrooms, and 6 lakh teachers are untrained.
This year's Annual Status of Education Report, ASER, speaks of India reaching towards universal enrollment. But of this, only 48% of students of class 5th could read a class 2nd text, whereas arithmetic continued to remain a big challenge. In this light, education strategists emphasize the need for greater spending on school inputs, results and quality.
It also required much higher investments in the most difficult to reach children. So you need a whole network of residential schools for homeless children, for instance, children of migrants, street children, working children. Delhi itself, I estimate we have 50,000 street children. We need at least 500 residential schools if we are really to fulfill our promise of the right to education for all of these children.
Clear as silver.
It helps in higher wages and contribution to a demographic dividend.
Government's focus on elementary education is a strong demand area, with educationists calling for improving the quality of schools rather than just raising the numbers. Like every year, the talk about upcoming union budget throws up the twin topic of gender budgeting and women empowerment. Expectations remain high about government making its promises on enacting gender-sensitive policies. Past experience has never been encouraging. Will this budget be any different? Let's look at the facts.
It is a shame that while the country has emerged as a major player amongst the emerging economies, the apathy towards the girl child is still quite rampant in these many parts of the country. Therefore, I propose to launch the Beti Bachao Beti Padhao Yojana, which will be focused scheme which will help in generating awareness and also improve the efficiency of the delivery welfare services meant for women. I propose to set aside a sum of rupees 100 crores for this.
For gender activists and professionals in the field, the Finance Minister's last budget announcement was a belated and quite insignificant attempt to iron out gender imbalances in India. It also marked yet another failure to bridge the gap between promise and practice.
We have a lot of young women who are now in workforce, and its issue is of safety and security, but it's not only to alert the police and sensitize the police, but also to give them safe places to live in cities. There are not enough working women's homes where girls can safely stay alone. So I think each city should have at least 5 homes.
In January, with much fanfare and appeals to emotions, the Prime Minister launched the Beti Bachao Beti Padhao in Haryana. But besides this 100 crore scheme, the government left untouched much that could have ensured gender mainstreaming.
Allocating really for the basics. So we need toilets, we need roads, we need lighting, we need GPS, we need CCTVs, and outside of the investment, of course, there's a whole, people need to be working harder at their jobs. So police needs to be more sensitive to women's issues, and we need a lot more women recruited into the police forces. So those policy and investment has to go hand in hand, otherwise there's no point of the investment.
Year after year, the demands in the gender department remain unaddressed, from providing toilets and hostels for women to properly implementing the relevant acts to prevent prenatal tests, domestic violence, improving the retention rate of girls in schools, providing good quality food grains, funds to protect child workers, social security for women in informal sector, skill training institutes, the list goes on.
We have not been as concerned about mainstreaming gender in budgeting, in the sense that gender should be the concern of this government in every sector. So it is not just in health and education, but also in environment, in science and technology, in food, in agriculture, in Panchayati Raj. How is it impacting women? And there are many invisible and visible ways in which government can play a very important role, and ultimately it's putting the money.
Despite making up 48% of the population, women lag far behind men on many social indicators. They have to face disparities in accessing to services, resources, and in decision-making space. Gender budgeting was introduced in 2005-2006 to remedy this. Gender sensitivity in resource allocations is essential for greater equity and fairness in public policy. Experts hope that conscious efforts are made to assure that no one is excluded from any opportunity on the basis of gender.
When you announce the Nirbhaya Fund, where is the Nirbhaya Fund? How is it going to be used? These are critical issues. We still don't have one-stop crisis centers across the city. But one-stop crisis center means you have to invest in it. It cannot be, a body with just one clerk and one receptionist and, doctors on call only. You have to have you have to invest in counselors, doctors, in crisis intervention services in general, psychosocial care particularly.
In addition to sufficient funds, gender-responsive policies need a deep commitment as well.
Government needs to also focus on monitoring of the allocated funds with transparency and accountability at all levels. So far, successive union budgets have managed to guarantee neither.
It's time for us to head into a small break. When we return, we will tell you more about health and skill needs. Welcome back. You're watching a special report on Demographic Dividend of India. With union budget around the corner, experts from the health sector hope that the government will not pay mere lip service to the goal of health for all. They also want government to focus on tax deduction in insurance and also providing free health services.
A healthy transition to adulthood lays the groundwork for a healthy adult population critical to realizing a demographic dividend. Public health programs not just promote good health but help prevent health problems that can undermine a person's performance.
To move towards health for all, two key initiatives, that is the free drug service and free diagnostic service, would be taken up on a priority.
With an annual spending of just 1.4% of GDP on healthcare, the World Health Organization ranks India's healthcare system at a lowly 112 among 190 countries. Nowhere near the lofty goal of health for all that the Finance Minister announced in Union Budget 2014-15.
When we say health for all, it would also emphasize on reliable delivery mechanisms of healthcare services, the infrastructure behind it, the resources, the manpower beneath all this. So it's a huge complex program then. It's very, in one single line we would conclude that health for all, but how do we achieve it? Where are the pharmacists? Where are the lab technicians? Where are the X-ray technicians? Where are the nurses? Where are the doctors?
At 35,163 crore rupees, allocation for the health and family welfare sector in the 2014-15 budget marked a hike of 27%, but towards late December, media reports said fiscal strains were forcing the government to cut nearly 20% in its 2014-15 healthcare budget.
There's virtually no primary healthcare services for the urban poor, and of course rural areas, forested areas, remote areas are completely unspent. So I would really again hope for a guarantee of free and universal health care, at least at the primary level for all persons in the country.
Health professionals feel the government can't afford a shrinking health budget, not only when it puts at risk key disease control initiatives, but also when the country needs a good insurance scheme to make services affordable and accessible.
All the different insurance schemes like the CGHS, the Employed State Insurance Scheme, the Rashtriya Swasthya Bima Yojana, all of them should be integrated into one scheme so that every citizen gets the same kind of service, same kind of insurance. And high-level expert group on health actually has talked about this kind of integration.
The country needs to tackle the serious challenges posed by the neglect of the girl child, high maternal mortality, sex-selective female abortions, and female infanticide. The most important aspect of this scenario is that the ratio is tilting more and more against the girl child.
Government is planning to transfer more money to these states. That is, Finance Commission's share of taxes will increase from 32% to 42%. It will mean that the centrally sponsored programs that are being run, they would be short by 1 lakh crores. At the same time, states will get untied grant of additional 1 lakh crores. So therefore, whatever is missing from the central scheme will be available with the state.
In order to be in line with other developing economies, experts feel healthcare allocation should go up to at least 5% of the GDP. The government wants to launch an ambitious universal healthcare program this year.
Given that China spends 3% GDP and the United States 8.3% on health, experts hope that the government will do better than previous years in setting aside higher allocation for health sector. has not been able to realize its demographic dividend despite a vast majority of its population in the productive age group. A good amount of work population is not employable, whereas most industries are currently struggling with scarcity of skilled workforce. The upcoming union budget could see a special mention for people in the skill sector.
A national multi-skill program called Skill India is proposed to be launched. It would skill the youth for an emphasis of employability and entrepreneurial skills. It will also provide training and support for traditional professions like welders, carpenters, cobblers, masons, blacksmiths, weavers. Convergence of various schemes to attain this objective is also proposed.
The upcoming union budget could see a special mention for people in the skills sector. With its focus on Make in India, hopes are that high that along with skill development, the government will have more clarity on how it plans to link it to job creation.
They should actually channelize more money towards skilling rather the old modern, old traditional way of education. We should focus on short-term programs which will actually help not only the industry but those who cannot afford to go into higher colleges. See, the growth of hospitality and tourism in India has been growing continuously. In next 3 years, there will be 500 hotels opening in India, and there's a vacancy for 1 lakh people. Approximately. So these skills program will actually help to fill up these hotels to work with people.
In a few days from now, when the finance minister reads his budget speech for 2015-16, his comments on Skill India program will be heard with great interest. Mainly because it's a key component of the government's flagship Make in India project. But experts say not skilling alone. The government should focus on job creation with monetary incentives and skill certification programs as well.
There is delivery capacity being created by the government through National Skill Development Corporation, by the central government ministries, and private sector itself also has been doing it. But we also need to very quickly create jobs to absorb the trained people. That's where I think the Make in India becomes so relevant. So if Make in India has to work, Skill India has to work. If Skill India has to work, Make in India has to work. These two go together in terms of job creation and equipping the people with requisite skills for those jobs.
In the 2014-15 budget, the National Skill Development Policy was allotted 10,000 crore rupees, too little considering the fact that India's skilled workforce is only 2% of its workforce compared to over 75% in all major economies. Also worrying is the spread of skills on offer. Professionals in the field say that not only basic computer courses, India needs people with the required abilities in other fields like construction and engineering as well.
So on the ground, what you are seeing is, you are seeing that, in 2008, where we had a skilling capacity of 3.1 million, this year the skilling capacity could go up to 1.05 crores, right? And next year you will see that again being enhanced going forward. The other thing that you will see is that there's a very close interlinkages and a whole ecosystem is being created to provide industry-led standards through the sector skill councils.
We really need to empower women, not only in terms of education but also in terms of skills, life skills, in terms of vocational skills. We need to invest in women's ability to protect themselves. We need to link them up to various schemes. Now there will be many schemes which may not be directly for women, but there are many women-headed households which need to be linked up to those schemes.
Instead of opening training centers directly, the government plans to partner with private firms to implement its program. The government targets to open up 1,500 to 2,000 training centers in next 2 years at a cost of rupees 1,500 crores to 2,000 crores annually, well within the budget allocation of 4,000 crores for Rural Livelihood Mission.
The country is facing a shortage of skilled force, which is expected to grow in the next 10 years. Currently, the supply of skilled manpower in India is approximately 3.4 million. According to the ILO, there will be a demand for 500 million skilled workers in India by the year 2022. A wide gap of 496.6 million skilled workers needs to be filled in next 8 years.
ये जिम्मेवारी मुझे मिलने के पश्चात मैंने इसमें अध्ययन का कार्य प्रारंभ किया है और ऐसा लक्ष्य है कि अगले 5 वर्षों में कम से कम 250 मिलियन नौजवानों को प्रशिक्षण दिया जाए। मुझे लगता है कि ये चुनौती भरा कार्य है, लेकिन प्रधानमंत्री के नेतृत्व में हम निश्चित रूप से इसको पूरा कर पाएंगे।
In order to do this, it plans to reduce the gap between educational institutions and the labour market. The budget is expected to indicate how it plans to achieve this.
Being at its early stage, India has better prospect of reaping its demographic dividend, identifying sectors of economy that can expand and foster the job growth essential for absorbing the large number of youth entering the workforce. That's all in this special report. We will be back with a new issue of New Report. Keep watching Rajya Sabha Television.